And most of the time you know what is a pulse. See, by simply pressing your hand on the radial artery, you will be getting some beating, and that is actually a palpation of your heartbeat. And this palpation of arterial palpation of the heartbeat is known by the name a pulse, and it is actually an expansion is caused by an increase in the blood pressure, because when the heart is contracting, heart will be releasing a certain quantity of blood into your artery, and that will be causing a bulging effect on your artery. And this bulging can be felt by placing a small finger. For example, if you place your finger here, you will get a pressure on your hand, finger. That pressure is what we normally call by name pulse. So pulse and heartbeat are somewhat directly related. So what is the number of pulse will be usually equal to the number of heartbeat. And this expansion and rise and fall in each time when heart is with the heart as it pumps the blood, then and it refuels. So here you can see that how can we sense there are certain areas of your body like a neck. If you place a finger here, wrist, groin, then that means then behind your knee there is an artery known as popliteal artery, then near ankle joint on the foot. So these are the common areas, but most commonly people will be checking the wrist, because wrist is easy to examine. So that is why wrist pulse are normally, or radial arterial pulse are commonly taken. So this is how the arterial count is normally taken. The pulse is the equivalent to measuring. That is the advantage of pulse. You cannot directly measure the heart rate, but the heartbeat and the pulse rate are almost equal. So heart rate can also be measured by listening to the heartbeat by auscultation. That is, one way of directly listening to heartbeat is that place a stethoscope on your chest and listen to the heartbeat directly. That is one direct way of listening, counting how many heartbeats are present. But the same thing can be measured this way also. So radial pulse is commonly measured using 3 fingers. See here, 3 fingers are using, and just see how he has placed the 3 fingers. This is a reason the finger closest to heart is used to occult the pulse pressure. The middle finger is used to get here this is the middle finger, and this finger is actually to suppress another type of pressure known as a pulse pressure. And middle finger is the finger that is directly used for getting the pulse, and the finger most distal to the heart, that is this finger, is used to nullify the effect of ulnar pulse. So in addition to the main pulse, there are 2 other pulse. Actually doctors are doing it this way to reduce or suppress the effect of other 2 and get the estimate of the main pulse. This study of pulse is known as spectrology. So spectrology is a branch that deals with the studying about the pulse. It's known as spectrology. So there are a lot of things regarding the pulse. It is normally generated by heart when systole. That is, during the time of heart contraction or arterial contraction, a certain quantity of blood will be pumped from your heart into your artery, and this is what we feel as the pulse. And pulse deficit is is determined simultaneous palpation of radial artery. So there is one thing called the heartbeat and the pulse rate may not be exactly same. Sometimes there may be some difference. That difference can be noticed by or calculated by measuring pulse by this way, and using your stethoscope you will be also listening to your heartbeat directly. So that way, for example, sometimes there may be a slight difference, and that difference is known by the name pulse deficit. So it can be a case of some atrial fibrillation, so some kind of heart disorders. So that is the advantage of measuring pulse as well as heartbeat using auscultation. So here you can see that what is the normal pulse rate, and in children it will be always more. So but as we get older, for example children of 10 years and older, will be having a pulse rate of 60 to 100 beats per minute. So well-trained athletes, people who are physically involved in any kind of sports activity, have a lower pulse rate. So normally most people will be having a pulse rate of 60 to 100. In case of children, that will be more, especially newborns, a higher rate of pulse rate will be always noticed. So pulse that is hard to locate may mean that is you are not getting the pulse. That is a sign that the heart is not working, heart is not pumping blood properly. So it can be a sign that some block may be present in your artery. So you may provide, then there are a lot of ultrasound scan techniques are also there for detecting heart blocks in arteries. So this is an idea regarding what is a pulse and how pulse can be used to determine the condition of your heart.